completely inflated like this. It's not sucking drainage anymore. So what we're going to do is uncap it.
Okay.
And then we're going to pour it into a graduated cylinder. Now this one doesn't have much, so I can get away with just using a medicine cup. But you might want a larger one depending on the size of your drain and the amount of drainage.
All right. And we're doing this every...
So you want to do this at least every 4 hours. This is a nice, good cherry Kool-Aid color. But if it was a little darker, especially if it had already been this color and it starts to get dark, that's active bleeding. And if it starts to move towards a nice chicken broth kind of color, that's great. It means the patient's starting to heal up.
Okay.
So then I'm going to just squeeze that and put the cap back in.
Right.
Now, don't ever milk this drain. Okay, so don't mess with it. Don't squeeze it. Don't strip it. None of that kind of stuff.
And then we always want to keep the bulb on a dependent to make sure it drains to gravity.
Yeah, and you can attach it to the patient's gown if they're getting up and walking around and being busy. So.
Very cool.
And then we're going to change the dressing around the JP site because I want to make sure that their site's not bleeding, oozing. I want to make sure that the drain's not being a burden to the skin and making little ulcers and that kind of thing. So I'm just going to completely take off the gauze that was there, and I'm going to open a fresh pack.
All right.
And I'm going to use an already split gauze so that I don't have the chance of getting little strings inside their surgical site. And then I'm just going to slide that under there to support it. And then if I want to, I can actually put another gauze like this back down.
Okay.
And just put that over the site and then just tape it down.
Now, one of the other things which you guys already know about surgical sites is, you know, the top three. If it's red, if it's warm, or you see purulent drainage, then probably indicates some type of infection. So you can do that assessment as well.
And if this site is draining really often, you're not going to want to tape this down a whole lot
Yeah.
because then you're going to tear up their skin. So you're going to want to put the least amount of tape that you can for their activity level and those kind of things.
And that's how you take care of a JP drain.